Hello. Hello. हाँ कहते थे हाँ सर it is audible. Hello. Yes. A very good morning. It's my pleasure to welcome you all to the participants who have joined us for different states of India. We all are glad to have you all in this one-day national level webinar on frontiers in chemistry. I kindly request all the participants to mute their mics. Firstly, I request Anusha to lead us through a prayer song. गजवदना वेडुवे गौरी तनया गजवदना वेडुवे गौरी तनया विजगवन्दितने सुजनर पूरे पने गजवदना वेडुवे गौरी तनया पाशांकुशधर परम पवित्रा पाशांकुशधर परम पवित्रा मूषकवाहन मोदक प्रियने गजवदना वेडुवे गौरी तनय गजवदना वेडुवे गजवदना वेडुवे गजवदना वेडुवे गौरी तनया. Thank you, Anusha, for such a pleasant song. Now, I request our principal, Professor C. Lingareddy, sir, to welcome and address the plenary.
Good morning and welcome to this national level webinar. Honorable speaker of this national webinar, Professor J. Manjana and Professor K. Kantaraju from Rani Kummama University, Belgavi. The participants from various states of India, faculty members, and all my dear students. I take this pleasure to join you all today in this national webinar on frontiers in chemistry organized as an ICAC initiative by the Department of Chemistry College. This is highly recognized center of learning in the northern part of Karnataka. I am in fact very happy to see the presence of many learned participants who have joined us on this online platform in spite of their various other studies. This will certainly provide this webinar an added profile. I take this opportunity to welcome our eminent speakers of this webinar, namely Professor J. Manjana and Professor J. Kantaraju, who have joined us today from Rani Chennamma University, Belgavi. I offer my wholehearted welcome to both of you on behalf of our entire faculty. I express my gratitude to both of you for your presence in spite of your many-fold preoccupation. I am sure we will greatly benefit from your presence and talk today. I also take this opportunity to welcome all participants who have joined us from different parts of our nation. I hope you all will cherish the moment which we spend today with us and our resource persons. I hope the discussion of this program will carry greater weight and reach the appropriate audiences. I would like to compliment the organizers of this national webinar for their initiative and their effort to make this a memorable event. As we all know, basically, chemistry is a scientific discipline involved with elements and compounds composed of atoms, molecules, and ions. Their composition, structure, properties, behavior, and the change they undergo during a reaction with other substances. In the scope of its subject, chemistry occupies an intermediate position between physics and biology. It is sometimes called the central science because it provides a foundation for understanding both basic and applied scientific disciplines at a fundamental level. Chemistry explains aspects of plant chemistry, the formation of crops, how atmospheric ozone is formed, and how environmental pollutants are degraded. The properties of the soil on the moon, medications work to collect DNA evidence at a crime scene, and many such wonderful things. Chemistry can be described as an academic discipline, one with academic department, curricula, and degrees, national and international scientists, and specialized journals. But it can also be described as a scientific field with widely recognized category of specialized expertise within science and typically embodied in both terminology and nomenclature. With all the recent advancements in the field of chemical sciences, the theme chosen for today's webinar seems absolutely appropriate and will consequently result in imparting a very essential knowledge in the field of chemical sciences to all the participants. I sincerely make an appeal. Try and grasp all the things discussed here to the maximum extent. And am very thankful to the speaker who will be sharing the much needed and vital information through this webinar. And I wish you gathering all your deliberations throughout this webinar. With this, I would like to conclude my welcome and plenary on this webinar. Thank you. Thank you so much.
Thank you, sir. I request Dr. M.D. Patka, sir, to introduce our resource person for the first technical session.
Good morning to all participants. It is a great honor for me to introduce our resource person, Professor J. Manjana, for technical session first. He obtained MSc degree in chemistry and PhD in industrial chemistry from Coimbatore University. He worked in Bar, Mumbai for as a PhD degree and then as a K.S. Krishnan Research Associated in the year 2002 to 2004. He moved to Japan as a postdoctoral researcher 2004 to 2010 under JSPS and JST fellowship at Hokkaido University and University of Tokyo. He joined Coimbatore University in the year January 2010 as an assistant professor in the Department of Industrial Chemistry and worked as a coordinator for in the September 2013 as associate professor of chemistry. He is presently working as a chairman Department of Chemistry, Rani Chennamma University, Belgavi. He teaches inorganic as well as physical chemistry to MSc students and supervising PhD scholars working on material chemistry aspect including nanomaterials for energy devices, environmental remediation and biomedical applications. He has guided 4 students and 6 are working under him. He has published over 75 paper in peer-reviewed international journal. Presently, as citations are about 1,600 and H-index 25 as on January 2020. He has 3 patents, one for Japan's and other 2 are in India. They have delivered 65 lecturers and he also received research funding from BRNS, DAE, DST and VGST. He is a chairman and member of board of studies and board of examiners in various universities. He has organized national and international seminars and conferences. He is active in teaching, research and administration. Today we are privileged to have an opportunity to listen Sir talk. On behalf of all, I welcome you, sir, to this technical, sir.
Thank you. Yeah. Yeah. Shall I go ahead? Yeah. Is it audible?
Yes, sir.
Yeah. Let me thank the Yale Society's JT College of Commerce, Science and all at Gadaga for inviting me to deliver this particular talk over webinar. Okay. So first, at the outset, I thank all the management of Yale Society's JT College, Dr. Linga Reddy, and the convener of this webinar, Manjunath Patgar, and the other organizing member, one Dr. H.K. Kumar, and all the team, entire team who have organized this particular event. So it is a privilege to me to share some of the research work which we have been doing and some aspect related to our webinar title, that is the frontiers in chemistry. So in fact, I had visited your college somewhat 2 years or maybe. I think Dr. Linga Reddy may remember my visit. So I think part of me, that I have a good interaction with you all. Nice that your college is nicely managed and has a lot of good facility and all. So it was nice to visiting your college at that time. Well, so I will simply get into my business of giving my talk on this particular title. So that is, I have chosen to present the resources recycling and waste management. Okay, so this is a part of your seminar title, that is the frontiers in chemistry. Okay, so what is that frontiers is? So frontiers is talking about something very hi-fi science, but at the same time, it is not just a hi-fi science, it is only, it should be an applicable science. Okay, so that is very important. In this direction, I have chosen this particular title, which we have been doing on this particular topic for several years. I think I will share. I will start sharing my slides, so then it will be good. Let me get into sharing the slides. Okay. So you are present. Okay. Now, are you able to see my slides now? Can anybody answer this, Manjunath? Are you able to see my slides? Hello? 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 Yeah, somebody should, respond. Otherwise, I will not be able to understand. One of you can unmute yourself and tag Manjunath. That what because there is a you are present. The slide. Uh, that what see I am presenting there. It is a showing like that what I am not able to share this slide. I was doing it this Google what is that? Sorry, not Google Zoom app. There is a used to be share slides. So turn up here also. Very good. At- On the screen, yeah, share screen. Can you guide where it is actually? That what you see. My this one is more option. I'm not able to find this particular sharing the screen. More details. Yeah. Like, there I don't see any share slide is not there. Full screen, change layer, setting, all this is there. I think you should enable me to share that particular slides. So that ah, see right now it is showing Krishna category is presenting. That you should not present actually. Uh, I press this button. Uh, Share now. Okay. Is now it is visible? Is it visible? Yeah. Is it visible now? No. See, this slide I have opened it actually, but why it is not showing that what? I don't know where is that sharing the slide. Shall I do that? Okay. I'll leave this and then again I'll join. It is showing stop sharing. So there is a. Okay. Just a minute. Hmm. Okay, just hold on for a sorry for the inconvenience. Hello. See, it is presenting now. It's showing presenting now. But where is that? Huh? Huh? But none of you spoke. No, I was asking whether you are able to see or something like that. I was saying.
Sir, now it is okay, sir.
No, whether are you able to see my screen?
Yeah, no, sir.
That what? No, but I have to show my slides. That is the. I'm not able to show my slides. Where is that? Present now button is there. Okay. That's what I was telling you. You better test that actually.
Sir, the present now you have to press. I think JM has to present like that has to come. Hello.
That's what present, but they are not able to see my screen. That is the.
ಅಲ್ಲ ನಿಮ್ಗೆ JM present ಅಂತ ಬರ್ಬೇಕಲ್ಲ.
ಅದೇ that what see. ಈಗ I am opening my slide. Wait, it is a. ಈಗ now are you able to see that?
Manjunath, why can't you do it in the Zoom actually? If it is possible. Zoom.
ಈಗ ಪ್ರೆಸೆಂಟ್ ನಾವು ಅಂತ ಹೋಗ್ತಿದ್ದೀನಿ.
Yes, sir. You have to press it. ನೀವು ಪ್ರೆಸೆಂಟ್ ಅಂತ ಬರ್ಬೇಕದು.
Yes, sir. ಅಲ್ಲಿ ಪ್ರೆಸೆಂಟ್ ನಾವು ಅಂತ ಹೋದ ತಕ್ಷಣ ಯುವರ್ ಸ್ಕ್ರೀನ್ ಯುವರ್ ಎಂಟೈರ್ ಸ್ಕ್ರೀನ್ ಅಂತ ಬರುತ್ತೆ, ವಿಂಡೋ ಅಂತ ಬರುತ್ತೆ.
ಎಸ್.
ಯಾವ್ದಾದ್ರಲ್ಲಿ ಯುವರ್
ಎಂಟೈರ್ ಸ್ಕ್ರೀನ್.
ಯುವರ್ ಎಂಟೈರ್ ಸ್ಕ್ರೀನ್ ಓಕೆ. ಬಟ್ ಅಲ್ಲಿ ಹೋದ ತಕ್ಷಣ ಈ ಸ್ಕ್ರೀನ್ ಬರ್ತದೆ.
ಸರ್
ಗೂಗಲ್ ಆಲ್ ಪಾರ್ಟಿಸಿಪೆಂಟ್ಸ್
ಮಾಡ್ತೀರಾ ಅಂತ ನಾನು ಅದಕ್ಕೆ ಫೋನ್ ಮಾಡಿದೆ. ಏನು ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತಿದ್ದಿಲ್ಲ.
ಈಗ ನೋಡಿ ಓಪನ್ ಇಟ್ಟಿದ್ದೀನಿ ನಾನು ಇದನ್ನ ಪ್ರೆಸೆಂಟಿಂಗ್. ನಾವೀಗ
ಬರೋದು.
Yes, presenting, sir.
okay, slide is coming.
Yeah.
That's what I was several times I asked actually, people did not. Okay, well, very good. Okay,
Now,
so sorry for this disturbance. Well, let me get into the business. See, this resource recycling and waste management is what I'm going to speak. See, this especially this waste management is a big issue in this. So though this, so as we talk about this frontiers of science, now it is a time that a lot of inventions have taken place. Management and recycling is a new buzz, especially in these developing countries. So we have to look into this, the resources recycling through this waste management and all. So in this issue, we talk about what are the different ways of doing this recycling and all that. So this is a very, especially this also, that aids this green chemistry aspects, wherein so we are supposed to have the sustainable development. So our the scientific development should be in tune with the ecosystem. That is, you should also take care of the environment, and without disturbing the environment, the development should go on. So therefore, the design of chemical products and processes that reduce or eliminate the use or generation of substances hazardous to human, animals, plants, and environment is very important. So therefore, you are all aware of that. There is a green technology something. Okay. So green technology, especially we being a chemist, we talk about the green chemistry. So here there are some 12 principles of green chemistry, which is very well known to you all. So that means there are varieties of way by which you can take care of the environment and use minimum amount of the chemicals without disturbing the environment. So moving further, see this green chemistry for chemical synthesis. So you all know that now a lot of all these chemicals are being prepared mainly from the petrochemical, the series. So that is the feedback for most of the chemicals. In fact, now there is a lot of scope to make use of the biomass as a feedback. Okay, that will reduce lot of the pollution being made from the chemicals. Okay, so therefore, so we have to think of, see, what are the different available options and all that. Further, see, I'll just move on to, see, in this direction, we have been working on, see, the various, the thrust areas, especially doing research and doing, technology development and all that. Because we chemists knows, how to solve this particular problem, because most of the all this pollution from industrial pollution to vehicular pollution and from the petrochemicals or the coal burning, all this through industrialization, whatever the waste that is generated, it's all some or the other way it is related to our chemical process. Therefore the we chemists only because we are responsible for making this the pollution, so we have a solution also, because and we can work better to solve this particular problem. So in this direction, see, the thrust areas to work, see a lot of especially this energy related, environmental and biomedical applications. Okay, so in fact my research group is focusing on these aspects. So today I will be focusing only on this resources recycling from a very, I have taken a very, important so one lithium ion battery, and from that how to recycle these valuable materials and all that. See, you have a various other energy stores, whatever that fuel cells, etc., which are also very interesting. Similarly, we also think of how to generate kind of a green sources of energy, like talking about say photochemical reactions, wherein you can even go for water splitting, producing hydrogen energy for the, so now green technology, that is the fuel cell that is being developed. Okay, so similarly, lot of kind of say at room temperature reactions, and especially reactions taking place at the sunlight energy and making use of sunlight. All this now most of the research and all is directing in this way, so that you should have a minimum energy and which should be environmentally compatible, environmentally benign process and all that. Okay, so that's how, so we have to shape ourselves and we should go with the environment. So in this direction, see, this particular slide is showing about say my research activities on this solid oxide fuel cells. Okay, and developing some different nanomaterials for biomedical applications, magnetic nanoparticles and clay materials and all, which I will be talking clay materials, and some redox resolution of certain metal oxides for decontamination of certain what is that structural surfaces. Okay, so now I'll begin with the topic on this recycling, especially from a typical waste, the electronic waste. So out of this, I am going to talk only on the recycling of this lithium-ion battery. Okay, so see, this e-waste business, I can talk a lot, and you are all well aware of this, and day in and day out you read about this electronic waste. Okay, that's a printed circuit boards. It is in fact kind of it is not a waste actually. If you don't if you handle it properly, it should not be called as a waste, because so there is a wealth in that. So, and not only that, you can recover a lot of good say materials, and you can also eliminate these toxic elements present in them and not getting into the environment. Therefore, so you should develop a very good technology to do such recovery of these valuable materials and all that, and separation of these toxic materials, so that you can save the environment. You see, the chemistry is a good subject, so where you have a lot of options to develop certain technologies. So that's how that the PC printed circuit boards are there and all those things. You have a lot of like rare earth elements, precious elements, all those things you can recover. Say here you see, e-waste is a combination of used or unwanted, say, are this spent, end of life, this one gadgets. Okay, that instead of throwing it, so you can think of recovering materials, and now a lot of scope for this particular research. Okay, so many developed countries now started, so we call something called urban mining. So urban mining is, see, in the conventional mining you go for digging in the environment and taking tons of ore materials to take out the few grams of these valuable materials. So here is a case in the e-waste, you have a lot of the useful materials in them, and you'll be able to collect that. So there are different methodologies being developed, like pyrometallurgy, hydrometallurgy, biohydrometallurgical process, so many things. So I am going to focus this hydrometallurgical route that we have been doing. Okay, so I will focus only our research work, and in the meantime, let us say some aspect I can cover additional things. Well, so in this, I'll just focus only on this lithium-ion battery, so which you have been using all the time. So for your mobile charging, isn't it? Laptop. Now this lithium battery not only here, so now it is being used even in electric motor vehicles. So now all for this green technology that we are talking about, it is all about this only. Okay, so making use of this, preventing this automobile exhaust and all that. In fact, this what is that? Lithium-ion batteries are used even in spacecrafts. Okay, spacecraft in a big way. So similarly, see all that that say solar, wind, and all that whatever the power that we generate can be stored in the lithium-ion battery. Lithium-ion battery is a secondary battery where you can store the energy, okay, and you can use it in your all, say this one, including say electric motor vehicles and all that. And how this lithium-ion battery works and all, you may be knowing slightly. So you have an anode graphite material, and cathode material has got different materials. So it may be a lithium cobalt oxide, lithium manganese oxide, lithium iron phosphate, likewise. So therefore, it is a very interesting, and especially this lithium. So I should talk more on this, particularly this lithium. See, lithium is a very precious material now, because year by year, the demand for lithium is increasing in a big way. So, and only some few countries have got this lithium. So only this, what is that? China, Argentina, and I think Bolivia or something, ABC countries they are called. So, and it's a very limited source, and unfortunately, we don't have alternative batteries other than this lithium right now, say maybe for another 10 years, to my knowledge. Okay, therefore, so lithium battery will have, that lithium especially, okay, cobalt to some extent we have, especially lithium. India, we don't have lithium at all. And the main source of lithium, as I said, in these three countries, some lithium minerals. Apart from that, say recently people are looking of extracting this lithium, taking out lithium from the brine solution. That is, the brine is this seawater. Okay, so there, it is present as a lithium chloride and all that. So people have been trying. Therefore, lithium is very interesting. So therefore, it is extracting from the spent batteries is very useful. Okay, because I know I have got good, a lot of demand for this particular work. Well, so as I am going to present, this is environmentally benign. So hydrometallurgical dissolution process that we have developed. See here, see we taking as I said, I have focused only one material here. So let us say lithium cobalt oxide as a cathode material in lithium ion batteries. So this is a very interesting electrochemical material. So electrochemically, so and this lithium cobalt oxide, you see, if you look at this one, cobalt is in +3 state. Therefore, so what we do is, we take out the lithium, spent lithium battery, and in collecting these cathode materials, I'll be telling in my subsequent slides. So here, see lithium cobalt oxide, cobalt is in +3 state, as I said. Now you can do, subject that material for redox dissolution, reductive dissolution or oxidative dissolution. So reductive dissolution is reducing this cobalt 3 to cobalt 2. So cobalt is bigger in ion, so that it gets ejected from the lattice and gets stabilized in the chelating agent present in your, say, dissolution medium. So similarly, oxidative dissolution is also possible. That is, you oxidize this cobalt 3 to cobalt 4 plus by using certain oxidizing agents. Okay, so therefore, as a redox dissolution method seems to be very interesting. And see, apart from that, simple, using mineral acids also is there to leach these materials. But the mineral acids, that it has their own problem. So we want to do a environmentally benign process. So accordingly, see, for reducing, agents, I've listed many, like, citric acid, tartaric, malic acid, glycine, ascorbic acid, oxalic acid, number of, see, these are all mild organic acids and which are environmentally benign. So for example, ascorbic acid is a vitamin C. isn't it? So use such a things and you'll be able to dissolve it and able to separate this cobalt and lithium as some precursors, like a, I'll tell that in the next slide. That is again you can reuse those materials. Let us say this, I am just showing you the different what the structure of this the mild organic acids, as I said. Now let us say, you see, these are, we could publish a good number of papers by doing this kind of very simple chemistry. Okay, so you see that we could publish enzyme hydrometallurgy, waste management, okay, and filing a patent and all those things, and environmental chemical engineering, many. Okay, so here is a methodology to share with you. See, we take a spent lithium ion battery and you discharge it completely, because you all know that there is a short circuiting and fire catch up and all that. You must have read several times. This all due to short circuiting of this anode and cathode materials in this lithium ion battery, because there is a in between that there is an FEN, some polymeric membrane, so for the electron transport. So that if it undergoes a kind of a damage, then there is a short circuit. Therefore, one should be very careful in that. So right now, so we have made some kind of a manual, say, discharging of that, and then manual dismantling, and then this anode and cathode we separate, and we have become experts in doing that very quickly, and taking out this, say, cathode material present on this aluminum foil. So there is an aluminum foil on that they coat it, and we collect it, and heat treat to remove some of the bending agents, etc. I'll not go all those details. And then finally, look quickly. So then, we take some X-ray diffraction of that elemental analysis. We should know, before treating any waste, we should know what are those elemental contents, isn't it? So there are varieties of methods to know the elemental composition of this material that you are doing. So you do something called, X-ray fluorescence spectroscopy. Okay. So there you can know the elements. So EDX, energy dispersive X-ray. So from that, so you do a backscattered electron, you know the composition. So like that, and also simple, dissolve it and put it in atomic absorption spectroscopy or ICP, OES, so several. Okay. So, and also see from the materials, some pre-knowledge will be there, what kind of materials are present. Accordingly, you can test all of them and then treat. So now similarly, we also did the laptop batteries also. In laptop, we'll have typically in typical laptop, there will be about 6 lithium ion batteries. Okay, so we know how to dismantle them and collect the cathode materials. Now in this slide, now I am showing you how this, we subject this particular cathode material which you collected into for dissolution. Taking these mild organic acids, I take a mixture of, for example, citric acid, ascorbic acid. I take. I will not go those different. Say, for example, ascorbic acid acting as a reducing agent, and the citric acid acting as a chelating agent. The chelating agent means, as I said, cobalt 3+. When it comes to cobalt 2+, it gets ejected from the lattice. So as soon as it comes into the solution, then citric acid will make a complex with that lithium. Okay, so like that, and along with the cobalt. So although I'm talking more of lithium, so cobalt and lithium comes out from the lattice. So both are stabilized in this one, but that stability constant is very, very small. So log K value, but that means it's a very mild chelating agent or a weak complexing agent. Okay. So we can check how this complexation takes place, etc., and what is the dissolution rate. All these things we collect data for our publication purpose. So now, once such a dissolution is over, then we precipitate it. See that, how do we precipitate? See, we precipitate that cobalt as cobalt oxalate. Okay, cobalt as, I have written here, cobalt as a cobalt oxalate, and lithium as a lithium carbonate. Okay, simply by purging carbon dioxide, it is possible to precipitate lithium as a lithium carbonate. And oxalic acid, by putting oxalic acid, I get a cobalt oxalate. Later, I can take cobalt oxalate and lithium carbonate in the stoichiometric amount, and I do just grind it and heat it. They decompose to form a new battery material. So lithium cobalt oxide will be formed. We have done that, and again it is given for reassembling the battery. Okay, so our product is back. So now you see, we could save a lot of lithium and also cobalt. Therefore, it's very interesting. So similarly, I also did that, as I talked about the oxidative or that reductive leaching. So there is another process which we developed, is the oxidative leaching. See, in the case of oxidative leaching, you see that, see, I subject this material for oxidative treatment. I used very, 1% bromine water. So you see that bromine water, the moment I say bromine water, people will be afraid because bromine is also equally toxic. In fact, in this case, you will see that it is contained. We do not allow the bromine water or bromine to escape from our reaction. It is a closed loop. What we did, we subjected that lithium cobalt oxide. You are able to see the structure actually. See, lithium cobalt oxide itself is a layered structure. So the moment I put it in the bromine water, you know that it's a very good oxidizing agent. It oxidizes our cobalt 3 plus to cobalt 4 plus. Once that goes into the cobalt 4 plus, lithium will automatically come out from the lattice. Okay, so those who are good in this solid state chemistry will be able to understand quickly that lithium will has to come out because cobalt 3 becomes cobalt 4 plus, that is this cobalt oxide, COO2. So you see that structure, and lithium bromide is formed. Okay, once that lithium comes out and you have a bromine in the solution, so lithium bromide is formed. Now see, I look at this cobalt actually, COO2, that is the cobalt oxide, that quickly transforms itself into a cobalt oxyhydroxide. Okay, so within that, aqueous medium, it is not stable, it gets into cobalt oxyhydroxide. Okay, that cobalt part is over. Now, perfect, see, it is 100% removal, and now see lithium bromide, I can precipitate that again. See, I distill it. So as I said, it's a closed loop. So I can distill that bromine, and I collect that bromine, cold trapping, and then this again the lithium hydroxide is formed that can be easily precipitated as a cobalt lithium carbonate. Okay, that's how we do it, and also we take out some adsorption of this lithium and different materials and all those things. Okay, this is how you can do kind of a lithium depletion. So 100% lithium depletion. So from this lattice, see, when we do studying all this, we looked at all this X-ray diffraction, how this lithium is removed with a different time. So partial removal to complete removal of lithium was monitored and able to see the thing. Then as we do that, in between, say, a partially dissolved material was characterized by XRD, and what is that, say, FTIR, so many things. These are all different characterization techniques just to prove our, say, what is expected and all those things. Okay, so finally getting that lithium cobalt oxide, that is very important, so that we got a battery material. This is a simple method. You see that it's a very simple chemistry, so we could do such a the kind of that is useful work. In fact, the same technology could be, the methodology, you can use different oxidizing agent, reducing agent, chelating agents, leaching agents, all that to extract, as I said, these valuable materials from e-waste. So talking about in e-waste, you can list many things, as I said. Okay, so if you take a printed circuit board, you have hundreds of elements present. So you can design to take some, for example, rare earth elements like a europium. Okay, so all those, even see gold is present. Okay, and you can remove this toxic material like that lead or say mercury. So all materials are present. So you see, recently we published such a how to remove this lithium and cobalt from this thing. Likewise, in fact, not only that, we have a further some more new strategies how to take out these materials and how to regenerate that battery materials and all that. Okay, so I will this is what it is about, how to take out those materials. Okay, so that's a very interesting to do things. Similarly, we work many things on as adsorbents and all that, carbon-based nanomaterials. These are all these days. These carbon-based nanomaterials have got a huge applications in any, say, including the adsorptions, catalyst, sensors, gas sensors, so many things. So like that, you can make use of them, and see, you can produce. See, if you go for purchasing all these materials, very expensive, but at the same time, you can produce these materials in the laboratory itself. Okay, so preparing this, say, simple graphene or say that graphene oxide, these are all now well established. Okay, so further, since this thing about talking is about the resource recycling, so this is what about the very simple case of demonstrating you to take out this recycling these materials. Okay, so moving further, this waste management. See, waste management also, I am focusing on this waste management aspect in my laboratory. So especially first I talk about this, because I have some good research project from Board of Research in Nuclear Sciences, Atomic Energy Group is one establishment, that is a nuclear waste management. So we'll talk about that, and so whatever the technology that we developed, and we can also use the same thing for treating the normal, say, the industrial effluents, say, degradation, etc. Okay, so let me enter into this nuclear, say, this, that waste management. Okay, so this geological disposal of high-level nuclear waste. It sounds very big for you, like, say, what is that nuclear waste, and you are afraid or something like that. So there is nothing to be of that kind. In fact, I worked for a long time in this particular field, more than 10 years, nuclear waste disposal. So here, because I don't want to bore you much on this, so simply getting into this, this nuclear energy is very useful, and there are certain concerns and apprehensions about the new safety and other things. But at the same time, you have a lot of technologies. You have to contain. So everything is unsafe these days, isn't it? Even say travel, journey, aeroplane, whatever it is, everything is has its own limitations and safety aspects. Therefore, nuclear technology also, if you can contain that, there is nothing like that. Okay. So, for example, where with a small amount of nuclear fuel, you will be able to produce huge nuclear energy, and that is in tune with our aim of reducing the carbon dioxide in the environment. We have all signed. India has signed the intergovernmental treaty to reduce the carbon dioxide emission. Okay, by 2030, we are we have committed to reduce about 20% of our emissions. Emissions means from the automobile to industry, everything. Okay, we are day in day out, we are loading lot of carbon dioxide. People talk something called carbon dioxide. How to mitigate this carbon dioxide in the environment? That. See, these days, lot of research. For example, how to take out this carbon dioxide. You develop some good adsorbents. So you absorb this carbon dioxide on varieties of materials, and people also think whether we can keep it back to this in the Mother Earth, say in the deep gel, in the subsurface, keep it back. Whether we can convert that carbon dioxide back to coal. In fact, the same thing has happened. See the coal, how it has come. So that was the same. We are digging the coal and burning it, and kind of recycling. Whether we can do that, people thinking in that direction, and lot of simulation experiments have shown that it is possible. Similarly, people convert this carbon dioxide into a useful fuel like methanol. Okay, and methanol is a very good fuel. So, and you all know that biofuels, etc. So ethanol, etc. producing from different sources. Similarly, carbon dioxide conversion to methanol. That is well proved now, but it has not gone for commercial purpose yet. But it is like catalytically it is possible to do that. Well, so let me come back to this nuclear issue. So in this way, so nuclear technology is lot, and especially India, like Indian country like India needs nuclear power plants. Okay, and ours is going strongly. Well, let me just point out something. When we say from the used fuel, that is the spent fuel from the power reactors, how it is disposed. So some of you may be knowing there is something called, we take out, we subject it for vitrification. Vitrification means, see, all those nuclear fuel, that waste, so the so-called high-level radioactive materials are entrapped in the glass matrix. Okay, so borosilicate glass matrix. So we make it something called glass formation, that is called vitrification. And such a glass, okay, in the glass form, it is again put it in the subsurface, say 300 to 500 meter below the earth in a very desert areas. Okay, so that is very interesting. So those details you can read yourself. So here, my our as a chemist, so we look at the, say, what you call that, something in the waste management. When we keep those, say, vitrified waste, surrounding that we put something called clay materials. So which you have been reading in inorganic chemistry, something called layered silicates. Different type of layers, silicate, smectites, 2:1 smectite, clay minerals, etc. Okay, so such a clay material is used because that clay has got a very good, good applications. Say, now I'll show you the structure called as there is a montmorillonite. That's a 2:1 smectite clay. Okay, 2:1 means so 2 tetrahedral units and 1 octahedral sandwiched. So octahedral unit is sandwiched between 2 tetrahedral silica. Okay, so this octahedral magnesium hydroxide is sandwiched between 2 tetrahedral silica. So then there is due to some kind of a lattice substitutions, there is a net layer charge on this clay mineral. So therefore, so between two such layers, there are kind of a exchangeable cations present. Okay, so this particular clay material has got a lot of applications. Just if you type in Google Montmorillonite, so you will find a lot of application. This peptide clay mineral. Okay, so including this waste management and making the organomodified clay minerals, adsorbents, because it has got a high adsorption capacity, swelling capacity, low hydraulic conductivity. Hydraulic conductivity means water cannot diffuse through that. Okay, and lot of absorption. Why it is put to surrounding this nuclear waste disposal is in the event of any over a period of say 10,000 years, etc. Due to I will not dwell all those things. If by any means the radionuclides comes out from its vitrified form, so this clay mineral, it's a kind of an engineered barrier. So this clay mineral will be able to pick up those radionuclides and it will get adsorbed there, and it cannot diffuse. Those radionuclides cannot diffuse through this clay barrier. Okay, so therefore it's a very good barrier layer. Okay, so that's how it has got a lot of applications. You can see that in these figures, some Japanese slides are there. So what that underground water, if it ingresses into that disposal area, as I said, we are targeting for 10,000 years because it has a high level radionuclides. If it enters this water bodies and all that, a lot of biological effects and all that. So therefore, it has a very high-fi research talking about those things and how it is disposed and all that. I will not tell those things. Now let me get into that. What was our business is to look at this, how this clay mineral will help in this nuclear waste management. In this direction, we studied how this radionuclides it can stop. What is the sorption capacity of this clay materials for the different radionuclides relevant to this waste disposal, and what is their diffusion process. Okay, so these are the things, and also how this clay mineral, how this clay itself is stable for say such a long time. Does it undergo any alteration? That is a phase, because after all it's a kind of we treat it as a chemical only. The clay is a silicate minerals. Of course, it is a primary mineral. Weathering product of primary mineral. It is quite stable, but nevertheless, you have as I said, between the layers there is exchangeable cations. So in this barrier we use some huge carbon steel materials as a overpack material. So carbon steel can give a lot of iron corrosion and all that. So ferrous or ferric type of clay minerals can form. So we have investigated such materials, how this ferrous or ferric type of clay minerals can form, how to make them. These are all very interesting study, like making those ferrous or ferric clay materials. And then subjecting. See, I show some of the figures how it is made. Okay, we did very simple method, and also you see that how this is compacted to different ray density. I mean, compacted means pressing. Because in that that engineered barrier system, it is compacted to very high density. So compact, and then we keep it for in the water saturation and apply radionuclide for diffusion. Okay, so diffusion we study using Fick's law of diffusion. So I have studied different radionuclides, like a typical cationic radionuclides, neutral radionuclide, anionic radionuclides, and finding their this one diffusion coefficients. All these are very useful data for nuclear waste management. These particular studies are well cited and well documented in many reports of nuclear waste disposal, especially in the Japanese Japan Atomic Energy Agency is often citing our data. Well, so you see that recently, as I said, in the last 2-3 years, we have published some 4-5 papers on how these different radionuclides are sorbed. Sorbed means adsorption. Okay, so sorption coefficient we say. So all these data have been collected. Okay, so like that. So these are now I come back to say once we do something called ferrous clay, ferric clay. Okay, so nuclear disposal is a waste disposal. Many people are not able to do that because in my case I have some BRNS project and have some collaboration with BRC, because for doing this radionuclear work you have to go to nuclear installations, safety aspects. We should have a training, all those things. Well, so how about doing simple, say taking those same ferrous ferric clay? You see that in the laboratory, in my regular laboratory, we were able to do something called dichromate reduction. Say chromate, is one of the again is a heavy element, and this chromium contamination is seen in water bodies, as also especially it comes from leather industries and also from the metallurgical industry, okay, and say plating and all those, okay. Therefore, say a lot of chromium you can see in the literature, say hexavalent chromium is toxic, carcinogenic and all that. People talk a lot about this, say reduction and immobilization. Reduction means hexavalent chromium, chromium 6 to chromium 3. Okay, so how that reduction you can do it, and then immobilize on the different adsorbents. In fact, I used this clay, ferrous clay. Ferrous, you know that Fe2 is a very good reducing agent. So ferrous clay has got a very good, sorption capacity. So it can reduce this chromium 6 to chromium 3, and then it get immobilized on the clay material. Therefore, it is very interesting. So we studied all that, in fact, we filed a patent. Okay. And not only that, you see, same ferrous clay what I did. Ferrous clay means you see in the layered silicates. So between this interlayer, between the layers, that's called basal spacing or interlayer spacing. So there is a ferrous ions. That's all. Now what I do something called in situ complexation. In situ on the spot. So I put some chelating agent between these clay layers. How do I do? Very simple. I take clay, ferrous clay. I put certain chelating agent, I just grind it, okay, and I am able to do some solid state reactions. I don't have to put it in solution, heat, nothing. Simply by grinding and all that, I am able to, there is something called intercalation. So intercalation of this reduced, chelating agent takes place, and the Fe2 gets complexed, and I can see that layer expansion of this one, okay, by X-ray diffraction, I am able to see this basal spacing increasing. Now further, in case if I heat that material, this chelating agents, there is an organic composition. For example, in my case, I took a ferrous clay and that 1,10-phenanthralene is a well-known complexing agent. So you complex it and layer it expands to about 18 angstrom, and then I heat it, decompose it. Thereby what happens? All this organic matter go away. So it forms a pillared clay. Pillared means 2 layers, and between that there is an oxide, iron oxide pillar, like just a regular pillar, like oxide itself is acting like a pillar. If you read literature, you will find that these pillared clays acts as a solid acids, and they have got lots of, you see what Lewis acid site, Bronsted acid sites, which we could find out by pyridine adsorption. If you take that material and keep it in the vicinity of pyridine, and pyridine is adsorbed. These are well-known methods, okay. And pillared clays and it's solid acid, and you can use these materials for part of say organic reactions, okay, acid catalyzed reactions. Therefore, in fact, so we did the same thing. See, these are all this making the clay. I show these figures and beautiful X-ray showing the different layer structures. Okay, and see, recently I show this figure. You see that beautifully. You can see that how this simple solid state reaction forming that kind of a red color, because Fe2 phenanthralene is a orange red colored, and you can see in solution is much more. Okay, then
sir, sir,
hello?
not observing the slides, sir.
Okay. Okay, now it's okay.
No, sir.
No, it was coming all right?
Initially it was, sir. Now it's not there.
It's not there? Okay. Is okay now? Now it's visible? Slideshow. Okay. Is now? Okay, thank you. I think I did not do the slideshow in the beginning. Okay, well, okay, could have. Because in the beginning I got nervous because it was not coming out. So, okay, well, now you see that, from solid state reactions, and we have shown how this beautiful formation taking place, and we could publish some good papers also in applied clay science, etc. See that, all these Bronsted and Lewis acid sites are shown on this clay. See, for maybe so many of you, your students are BSc, I think they will not be able to follow that, but simply I will tell you superficially that these materials are very good catalyst. You used in something called, typical something called Bignili reactions, okay, and converting some kind of a 4-nitro, phenol, and some organic, very simple reactions that we could monitor in using UV spectrophotometer So like this is recently published in this year. Okay, organo-modified iron montmorillonite as a solid acid catalyst for the reduction of nitroarenes. So there is a nitrobenzene and Bignili reactions. So nitrobenzene converting into your nitrophenol. Okay, for nitrophenol or something. So that's how we could show varieties of these reactions like that. See, we also earlier I made filed a patent on this solid acid catalyst, and we have also studied how the stability, thermal effect, all that. And as I said, we have also used these materials for chromium, so all that. Okay. So moving further, so we also do something called okay, all these so in this case, of this the nanomaterial is less than about 100 nanometer. Okay, so in this case, you see that carefully this FESM scanning microscopic image, the diameter is less than 100 nanometer. So I call it as a kind of nanobox. Okay, and see this kind of and we could do something called granulation. Making that granules. Okay, so and we can load in a column, and then all these toxic materials, including that. And similarly, you can we also did something called kind of materials. The same materials now with the collaboration and the making okay. So details like this different forms and use it. So as a first of activity, see some so similar in the itself. So high level integration.
Hello. Hello, sir. Sir. Okay. Hello. Hello, sir. Joining, sir. Okay, sir. Hello, sir.
ಆನ್ ಮಾಡಿ ನಿಮ್ದು ಇಲ್ಲ ಇಲ್ಲ.
Due to some technical problem, the session is ended. So thank you, sir, for such an excellent presentation. Now the next technical session begins. Now I request Dr. Kumar HK, sir, to introduce our resource person for the technical session 2.
Good afternoon, all. I am glad to introduce our resource person, Dr. K. Kantraj, sir, for this technical session 2. Professor K. Kantraj has received Bachelor of Science in 1998, Master of Science in 2000, and Doctor of Philosophy in Chemistry from Bangalore University in the year 2006. He worked as an executive research and development at Cadila Pharmaceutical Limited, Ahmedabad, and also as a DPT postdoc fellow at Molecular Biophysics Unit, Indian Institute of Science, Bangalore, under the supervision of Professor P. Balram. Later, he moved to NIH postdoc research at Drexel University College of Medicine, USA. After his return from the postdoc, he joined NITK Surathkal as a temporary faculty at Department of Chemistry. He presently working as a professor in the Department of Chemistry at University Belagavi, and he is having 20 years of teaching and research experience. He has many honors and awards for his credit, namely UGC Meritorious Scholarship for 79th rank in BSc, second rank in MSc Organic Chemistry, CSIR NET DBT Postdoc Fellowship, NIH Postdoc Fellowship, VGST, and Vice Chancellor Appreciation. He has published more than 45 research papers in 3 reviewed journals in national and international journals with 1 US patent, and presented more than 80 papers in national and international conferences and delivered 25 invited talks at various scientific events. He has completed 3 major minor projects sanctioned by UGC MRP, VGST, and his research interests include
Thank you, sir. Now I request our resource person, Dr. Kantraju, sir, to take over the session.
Thank you so much. Just a minute.
Yes, sir.
Can you see my slide?
Yes, sir. Yes, sir.
Visible. But how about the movement? No, movement is not going on. It's clear. Yeah, but I made it, I think PDF, it may not work, I think, PDF. Now?
Yes, sir.
Very good, very good. Yeah. Okay, thank you for this. So good afternoon, everyone. Hopefully everyone audible now?
Yes, sir.
Yes, sir.
Yes. Good, great. Screen enlarge. Yeah, it is done. Site tool. Where in the bottom? Top one. I'm done now. I'm done. Shit. Yeah. Okay, now visualize now. Can I send? Can I send? Huh? I'm done full scape, man. Left corner. Okay. No. No, man. File symbol is there.
Sir, sir,
It's not working. See,
sir.
what you can do. Hello, I have that PPT. Can you do it? Okay. Can you tell your?
Hello, Isaac, sir. Like it is visible, let him proceed. Yeah, sir. It's like visible.
Okay. Okay, all right. Good afternoon, everyone. I thank JT College, Gadak, management, principal Professor Linga Reddy, and convener Manjunath Patgar, and organizing secretary Dr. Kumar for arranging this webinar. So in this pandemic, only we can see in virtual and online. This pandemic made us to see everyone around the globe. So through virtual or through webinar. So let me start this national webinar. So frontiers in chemistry. Already my colleague has spoken many things about frontiers in chemistry. Just I am going to touch you a little more about translational research, how these drugs are developed in this, situation. So one of my research component earlier, actually it was done in postdoctoral. Okay, the multivalent aurum nanoparticle peptide triazole conjugate in inactivation and virolysis of peptide. Because I knew here many of you are background of a master degree. Just I am going little more basic for the interest of student. So let's see. So what is the drug discovery? So how this drug discovery goes, and what all pathway take to go to develop the drug which is available in the pharmacy, which are the player indirectly or directly to get the pill in available in the pharmacy. We should understand. So in this regard, you already knew, many of you, the drug, what is that mean? The drug in the broadest of terms, a chemical substance that has known biological effects on humans and other animals. That's what we take actually. In pharmacology, a drug is a chemical substance used in the treatment, cure, prevention, or diagnosis of diseases, or used to otherwise enhance physical or mental well-being. So hopefully you all master student, even research scholar can understand why we take this pill, and you know what is the speed of recovery, all those things. So let's back. So how these drugs are developed or discovered? So the drug discovery is not a unique subject. It is a cocktail of many subjects. It is involved where all the subject expert and the data come together together, then only you can get a lead molecule. So it's a involvement of biology people, chemistry, physics, and pharmacology and molecular biology. So all this subject which is going to give input to develop what is called a drug discovery. All right. So let's look at the cost involved. Means you can see in the pharmacy and even today this period actually we are getting more experience the cost of this drug molecule, why it is so and all. Okay, so to develop novel drug molecule, to develop novel unknown drug molecule, minimum is, so you are going to spend at least 800 million to $1 billion. So for development, the success rate already said that it's a 5,000 to 1. Means if you take a 5,000 lead molecule, so you may are lucky. So then you are going to get one come out as a drug molecule. The obviously the time duration is the more important. That is the reason even in this pandemic you can see it. So we can't get immediately the drug, but now we are using a other drug which are already in the lineup. So we are going to take as a complementary the drug molecule for the purpose today. So minimum at least you can take the time scale of 10 years and above. So as in chemical drug molecule development, in biological drug, the biological drug means what? If you are looking for a vaccine, if you are looking for a protein, or if you are looking for something like diabetes, that is insulin, such kind of molecule if you want to develop, usually it's a straight up answer actually you are going to get. You are going to produce the drug molecule, biological entity, so through some fungi or bacteria. So there that purification and other stuff you are going to do it, and it will be acted as a biological drug. Let's see what are these affordable drug. Okay, so we already knew the most everyone thinking. So the drug which you are making must be available remote of the remote person, or any one kind of needy person has to get or afford such kind of molecule. That is what the main intention of making or developing a drug molecule. So here you can see the simple aspirin, that is acetylated salicylic acid, and paracetamol. You can see this you guys knew now. So very prompting drug molecule for this pandemic also. The paracetamol is the highest consuming today because of this COVID also, because it's a antipyretic and inflammation, so even painkiller. So people are exclusively taking this simple drug molecule. This is the reason why paracetamol, aspirin, diclofenac are going to be much cheaper if you look at the simplicity of its structure. And obviously this structure can be made easily. I mean this derivative can be made easily. So and obviously the cost of that molecule will be cheaper. So then it's available tons together for the needy people. So another one is there in the Taxol. So might be you guys come across the Taxol is an anti-cancer, which is beginning derived from the natural, because that is one of the most drawback of natural medicine, because the demand and the present scenario, the demand of the world not to be met by just only depending on the natural product. That's why the chemist is looking for a alternative and to make those active pharmaceutical in a laboratory in the kgs or tons together scale. All right, so hopefully you can listen. I think is it audible?
Yes, sir.
Great. What about the slide?
Yes, sir. It's clear.
Okay. So just I'm going to give, because master's student are there, maybe they can help actually, even if they are interested to industry. So this is another one, the drug discovery, what are the stages it is involved. Even today we talk, even if you sit in the TV and all, you can check it. So daily we are seeing a new result for the pandemic of this COVID against. So drugs or vaccine and all, because it's not a a day process. It is involved so many paths we have to go through, and obviously it is a time scale related discovery of this drug molecule. So the first and foremost is the discovery. Means anything. This is the foundation step actually. Something if you have something material or compound, then only you can think what can be done like that. So for this, what is that discovery? The discovery obviously you can think it is possible in the laboratory of organic chemist or the laboratories. Usually the organic chemist can make this kind of molecule. Once the molecule is prepared, then usually go for a target identification. Means by the background of today, I think you already knew that. So parallelly, we have another additional so helping hand, that is computational chemistry, because of robust, speedy, and a lot of improvement in the computational software and discovery. So today we are good. Actually, the chemist be happy to get better idea by using computational, so that idea can be implemented in the laboratory to make a better lead molecule. That will obviously save our time as well the cost. That is the most important. The discovery is happening today, so because of the combination of both wet lab and computer, so can does the to get better lead molecule. So that is what the identification of target can achieve easily. So another most important is resource. So I think in the next slide I'm going to talk here. So resource means where it is abundant, whether it is available in a bulk quantity or a partial. All this we have to think also. That is the most important. So whether it can be semi-synthesized or completely synthetic or completely natural. So or it is derived from animals or some fungi or bacteria or microbes. All this we have to think about. This is the first and foremost stage for the foundation of drug discovery. Next stage is it generation. Means once you have a cocktail of so many molecule, so if you are doing one molecule at a time, it is very tedious and very lengthy. So obviously it is not economical or time. Okay. So to make more robust, actually the chemist or the biochemist has come up with idea what you call. So hit generation can be done in combinatorial or in a bulk process by multi-well or ELISA kind of testing for the robustness of getting a target molecule. So for this, what we do, develop process and test substances. So whatever you developed substance, I already said that I think in between this, you have to apply very thorough analytical technique to make sure that all the molecule you prepared or must be at the highest purity. That is the most important the drug industry look for. So 99.99% of purity must be there. That is the utmost. So the people are asking, so how what is the purity and all, that is must be there before going to second stage, that is it generation. Then develop process means once you develop synthetic process, you must go for further in vitro studies development. Means by using bioanalytical and molecular biological assay in the laboratory, usually what we do is, so we'll take pure compound and take in a suitable solvent media or buffering media. So then we go for extensive bioassay. So bioassay can be done if you are directly doing translational research. So usually the simplest is 96 well plate. Might be if you are in background of biology or zoology, might be you guys come across the ELISA test. That is 96 well plate. So where serial dilution of your sample will be loaded on the target protein which is adhere on the well plate, and by using primary and secondary antibodies, so you can develop suitable color. So the intensity of color it is showing. So usually the extent of its binding or non-binding. So based on that, usually bioassay started. And we have very good another bioanalytical like SPR, surface plasmon resonance, isothermal calorimeter. So all this assay is called bioanalytical, will give at real time, you can see direct interaction of your ligand to the target protein or target diseases can be estimated easily. Surface plasmon resonance. So even it is an expensive process. Even one time, if you want to run a sample, minimum you need 25 to 30,000, even one sample, because those techniques are very expensive actually. So there, but you will get a very good idea or very good, result. So whether your molecule is active or non-active can be determined by using such kind of bioanalytical tool. In the third stage, usually lead generation. So once you get a lead, means all the in the laboratory level, in the molecular biology or biochemistry lab, you are going to get at least some idea about whether it is worth to do further and all. So by looking at that data, so they are going to look for a third stage, that is the lead generation. It is called in vivo testing. So you already knew that in vivo testing usually done in the beginning by mice, rats, rabbits, monkeys, all those, all animal other than human. So usually it's going to test it out. That is to conduct in vivo. So if you are good in understanding, in vitro usually done in laboratory, in vivo done it in the field. It means that is a special for animals. So usually taken into in vivo testing. So there at real time with the dose response, they are going to take out the serum or blood from that animal to see what is the fate of your molecule. That is called a pharmacokinetics, ADME. You guys, I think MSc student come across. It's a absorption, distribution, metabolism, and excretion. So all these four parameters is at most, so when you take a drug molecule, so all four stages or four step has to be completely understood. So then only it is, you can say that it's a good drug and all. That ADME study must be done proper way. There is a standard protocol. You might be looked at. US FDA is monitoring all this thing when you want to sell your drug molecule around the globe. So one has to give all the information from analytical, like HPLC profile, to all this data. Then only they are going to accept. So obviously pharmacodynamic studies means what is happening, means what drug does to the body, whether it is a toxic, whether it is going to give any side effects. All this parameter is also going to be parallelly done by using what you call a pharmacodynamic studies. So this is the third stage. Once it get through, so usually it's going to be clinical development. So that is what a final touch. So there is this, again, it is a phase-wise clinical trials will be there. They can't go for a mass directly. So they take some group of, humankind. So 10 or they have a very specific number. Based on that stage-wise, they will go. Finally, it is going to be mass human being. So thereby, they are going to see the complete study of it is worth and all. So even it is all from 1 to 4th stage. It's not the company or the who is working on this area not going to stop. They keep on doing parallel, So one more stage, one more batches of sample, and again they go for a series of this kind of examination to find any possibility of any side effects with other even nowadays it's a very delicate system of our human mission. So here the person can have so many other diseases like diabetes, hypertension, so other infections and all. So how it is going to affect with other diseases, one has to be looked carefully. That is what you might be looked at many times when you go to the doctor. So they will ask for many very strong drugs, especially antibiotic earlier, whether you have taken earlier or it is okay kind and all. So because it's affecting more or very strong, so that is the reason. And obviously post-registration, can you watch this screenshot? Screen is, can be watched now, screen?
Yes, sir.
Okay, very good.
Yes, sir.
So post-registration, so ultimately it's going to regulatory affairs and finally go to the market. So monitoring and human trials is completely thorough. That is the reason earlier I showed why it is take so much of time. This is the reason again another what we have today pandemic also in the same line, because in the day one you can't get any drug molecule for the treatment, but for the safe and sake because of the advancement of science and technology. So today at least we have alternative. So those are going to be save us for a while, but ultimately in the coming days one has to get, so either vaccine or a drug or both is going to come up for this kind of development. So this is the one I think whatever I said earlier. So even you take 5,000 or 10,000 molecule, lead molecule, it is each can be derived from combinatorial chemistry or mass synthesis. So then it is going to be filtered like a preclinical, then clinical trials. Ultimately, if you are lucky, ultimately if you are lucky, so it may lead to one as a drug molecule. This is the timeline and the stages which is involved. You can think about the molecule from bench to pill. They called actually bench to bed. You can say bench means where organic chemist does the reactions, and bed means usually in the hospital. So that is what bench to bed. So the molecule can be generated through that kind of flow chart. So again, I want to know what are the resource identification is available. The potential resources you guys already knew that. So to get novel drugs, natural organism, the mother nature is having everything. Only thing we are now searching about all these things, or some of them are more exploited. So because of all this, we are seeing so much of variation in the lifestyle, even in the natural calamity, all these things. Because if you more exploit, again, it won't be tolerable. Then it has to go self, sustainability. It goes all this problem. So obviously we have to monitor everything. Then only it is easy for the life of humankind also better. Instead of go away and regret everything is not easy. So it has to be taken very wisely, and we have to, so obviously protect the nature. So then it is giving a lot of things, nature. You can see through plants, fungi, bacteria, you might be looked at or know this idea about antibiotics, how it was developed, penicillin by soil and all. So similar way. And combinatorial chemistry, I already said that by combinatorial chemistry, you can make at a day, so hundreds of molecules. If you are good in designing and making, we have automated machines. If you give the supplement or reactant, you will get a derivative of different, and obviously that will lead what you call structure based drug design. So if you know already some skeleton of the structure of the drug molecule, from there you can decorate many things by hydrophilic, hydrophobic, or by interaction, or many. So by using computer aided drug design, so one can get a better lead molecule. This is what we Indians are here. So we does many of the companies, so they not do all this above compound. We do more on SAR studies. Whatever already reported in the literature or in the discovered, so we are going to decorate that one. Obviously that also good. So it will lead a very good efficacy and also cost effective. So almost all our Indian companies are does this kind of work. All right.
Dr. Priya Satish Prabhu, ma'am.
Okay. Methods for drug discovery. Okay. So high throughput screening of random samples. High throughput screening is one of the technique nowadays used. So because you have 10,000, 5,000 drug, you can't do it daily one basis. It will go 1,000 days or even more. So to come down or to go further, speed up. So what it does, HTS they called. That is what I said already. Even in the synthesis, we use combinatorial. Even in the in vitro studies, we are going to use such kind of screening to get a better lead molecule. So including screen development, primary and secondary screening, all these things. So obviously you guys knew the traditional use of natural organism for medicines and plants. This is what naturopathy or so what you called today we are using. So naturopathic tablets and even homemade medicines for some of the mild, the diseases and all can be used. let's look at this is a just brief because MSc students are there. Hopefully, they can get some insight how these drugs are going to be developed. Even though I'm in a hurry or I'm going faster, I can understand because of many reason. So at least you can get brief of how this drug at least developed from scratch to bed level. So let's look at outline. This is one of the work actually real research work was done. It is a translational research. So let's look at what is HIV and entry process, how it goes, and what are the present remedies are available. Okay, how it goes and what our means when I was in postdoc at US, there I worked on directly on the peptide derived drug, which is going to be very fantastic actually, one of its kind. So and unique property we found, and no one is explored such kind of property, and it's amazing actually. So we'll see at least coming days what will happen with that molecule. So let's look at before delay. So I think many of you knew the summary of the globe. HIV epidemic. Almost 38 million people are living with this. Okay. Your skin is still visible while someone is else presenting. Click here to return to the video call.
No problem. It is.
Okay. So the summary of the global HIV epidemic, you have 38 million at 2018 actually. The WHO, well known in this epidemic, what is the WHO and all. Okay, 38 million they quoted actually. So overall in the globe, okay, so those is the strength. Let's look at instead of the epicenter of the HIV is usually all new South Africa, where the people talk about it's come from chimpanzee and monkeys to the human. So where they ate raw meat of those actually, and obviously transmitted to the human. So now you guys talk about COVID from bat to the humankind, where the Chinese people eat these bats for food habits and directly transmitted to the human body. So that is COVID-2, what we call COVID-19. Okay, so let's look at how it is similar. We'll talk later. So before that, just I want to give a glimpse of India. What is the scale now? Almost 2.1 million people are suffering. Means 21 lakhs people are there in India, and you can see many other parameters of the treatment and all. HIV statistic in Karnataka, if you look at again back to local. So we have 2.4 or 2.5 lakhs, you can say 2.5 lakhs people suffering from this HIV, and you might be looked at, it's a very pathetic actually. If you know here in the social life, if the person is having HIV and all, people not easily accept. Usually they will beaten or throw away, and obviously by psychological and societal force is going to be end of his life actually. More of the such kind of cases usually occurs in India, but not the case in other countries, because there they kept all their medical information very confidential. So obviously the even neighboring person doesn't know what he is and all. But obviously this is not such kind of like COVID and all is not a problem. Okay, so let's see what is this life cycle, how it is involved. So I think you might be looked at recent COVID-19 also, similar kind of structures actually you can see in your TV screen and all. So having a similar kind of structure actually. This is also virus, that is also virus. Okay, let's see how it is going to be work here. So what kind of or how transmission takes place. You all knew that the transmission of HIV goes major, it's a blood, through blood. So even today, or many times you can see in the newspaper, so the negligence of the doctor, where the blood transfusion takes place from one person to another, if they not check proper handling of test, even I request you all, whenever you are recommending others to take the blood, you make sure that even get delayed, not an issue. The blood has to be completely thoroughly tested its HIV contents, whether it is there or not. No, this one, even your friend doesn't matter. Even in the recent, you might be looked at all the pregnancy has to be undergo this HIV test. So similar way, so that major entering of this HIV to one person to another through blood transfusion and saliva and other fluids and multi-partner sex and all they called, okay, and even barber shop. So these are the major listed, way or mode of transmission of HIV into one person to another. That is what you might be looked at usually. So the blood where the lifetime of the virus can be sustained or can be retained, and immediately if it goes to another human body by this kind of mode, so it is going to establish its colony, and obviously it will start making its own, and it is going to interfere with the machinery which is involved in the human body. This is what human body does for the circle middle. Usually this is what taking place. Once the virus enter into the body, so it is directly goes to the mitochondria, and where the synthesis of proteins taking place in a body. How it is? This is the most important actually, because it is called envelope protein. You can see it is containing a CD4 GP120, which is the CD4 is our immune system actually. So our body is having immune system. Now here you can see the COVID-19 actually it's going to be bind or take a path of ACE2. So angiotensin conversion enzymes they called. We have the ACE enzymes which is present in our body, so where it is taking enter into our body in that path. But here our this one HIV is going to take exclusively the CD4 receptor. It is a immune system present in our body, and it is a transmembrane where the above this machinery it's available and going to attract, or it's going to take that path entering. So once it is going to be bind onto CD4. So you have another here you can see in the purple kind or violet color. So where it is called co-receptor. So with the help of receptor and co-receptor, so it is going to resume your presentation. Your screen is still visible while someone else is presenting. Okay. So what will happen? So it is going to be take both CD4 and co-receptor they called, receptor and co-receptor they called. So it is going to enter into the body. Once it is enter, you can see that so the genetic information which carries the virus, it is enter into the body and getting unwind, means it's going to be open up. So the most important here is your RNA. That is why called it is a retrovirus. The same your COVID-19 also, the virus which carries RNA. That is the genetic material where from RNA which is immediately enter into our body and going to be involved in the machinery and produce more number of infected virus. The more number of infected virus it is going to generate, obviously our health system is going to be deteriorate, and obviously depend on where it is affected, is whether it is very delicate or partially okay kind. So based on that, fatality is going to be decided. So in this case, you can see it. So the most important stage is here reverse transcriptase. That is immediately once enter this virus into the body, so it is going to wind up this RNA which is carried. That RNA is most important. So what will happen? And RNA along with the enzymes that is called reverse transcriptase, along with RNA, and this enzymes plays very crucial role for multiplication of virus in our body. So you already knew what is HIV. So once it is going to be multiply, millions of virus get started. So obviously our immune system going to be deteriorate or collapse. And even simple cough or even simple like what is called seasonal problem like cold, fever and all. So we are going to vulnerable because of we don't have any immune, like our LOC you can think. So if you just imagine in one night if our LOC people get a strike like others, so not working. So what is the fate of our India? You can check it. Even either side you can choose China, other side you can choose Pakistan. Okay, so what will happen? You can think about similar way. So if the immune system is not there, that is CD4 in our body, so you will get affected by simple diseases. Obviously, it is going to create more complicated, and ultimately, it's a more like a TB, cancer, and diabetes. This ultimately lead death to the patient. So you can see it here, transcriptase may be important, and again it is undergoing so many pathway and give again a matured so daughter viruses. For this, if you understand anatomy and life cycle of any of the diseases, that is how it will take long time, because now at least thank actually the so much of technology is available to see all this. Even today you might be looked at cryo electron microscopy is going to be very fantastic, especially for biological sciences or biomedical research, because of its simplicity and high resolution. Even you can see lively the proteins, virus and all. So with that technology, at least it's getting more faster to get better quality of understanding. Once you understand this concept of molecular biology and biosystem, so then it's easy to target all these things. At least now we have 7 to 8 stages we can combat this HIV, or we have this drug molecule. So let's look at more importance. That's what I said, because this virus carries RNA, that is genetic information, and it is going to enter into the host cell. That RNA is going to be opened up and it is involved in the or interfere in the body. So thereby it's going to create more and more of its daughter viral proteins. Then obviously the number of virals going to be increased in our body, so the immunity of our body going to be decreases. If your immunity goes decreases, we are going to welcome all sort of diseases, which means that it's going to be more and more complex and cocktail. So ultimately it's going to be fatality. That is called AIDS. So then HIV usually 5 to 10 years, they said that if you are not controlled or not monitored properly 5 years, so it's going to become what you call AIDS, that is acquired immunodeficiency syndrome. So once it is acquired, even God comes also, no one is stopping to die him. Once AIDS is there, it done the job. But once you have HIV, but you can, at least today technology, you can save him like us only, no problem. You can live like us as long day to day. So monitoring and medication must. So let's look at how it is going to be the most crucial thing, because why I'm taking this piece, because the peoples are using this kind of technology to combat this, and even more drugs are developed based on this mechanism. The CD4, once it is entered, you just in our membrane, in our core cell, what will happen? That's what I said already. The HIV RNA. This is that is called reverse retrovirus. It is called. Usually many other virus, which is flu and others, so usually they that carries DNA itself, but this virus is carrying RNA. So what will happen along with this enzyme reverse transcriptase? So what will happen? The reverse transcriptase work is that convert RNA into DNA, because ultimately the DNA is most required. DNA means it's a double helical structure. That's it. You guys already knew Watson and Crick model. So where the DNA structure, that is polynucleotide, going to be a wire coil like double helical structure, that is DNA. RNA is a single helical, single structure, because it's not going to be wind up. That's why it showed like that. So the enzymes usually people are combated. The reverse transcriptase enzyme itself, people are targeted, and very good success. So obviously, once you stop the binding of this reverse transcriptase enzyme, so the enzyme is inactive. So obviously, it don't want to do the RNA conversion into DNA. Is no DNA, so no production. So obviously, you're going to stop it. But you think till today we don't have complete eradication of this virus. Still, will be there. The patient who are infected, but he can lead the normal life, no effect. But as I said earlier, so must be taken care. So let's look at these are the thing actually HIV RNA reverse transcriptase. So if you are not using reverse transcriptase, or that is what drug they called NNRTIs, so non-nucleoside reverse transcriptase inhibitor, and another one is nucleoside reverse transcriptase inhibitor. So this is the one extensively people are working on this and found very good success and can be stopped. So in the right hand side, you can check it. If you are not controlled, means if you are not taken precautionary, or if you are not go to doctor and made it monitoring, so obviously at a given rate of time, so or some time, so it's going to be increase its production of more and more viral variant they call. So ultimately it's going to be acquired immunodeficiency, means more number of concentration of virus is going to be more, so the infection is more vulnerable. The infection is more, obviously it's going to be acquired immunodeficiency. So no more immune system in your body, that lead fatality. Let's see. So at present you can see 31 drugs of 6 classes. I said already 6 classes means the stages which are can be stopped by looking at a complete thorough of molecular biology and biomechanism. So these are the drug molecule, very tiny. You can check it actually. This is what the one of the medicinal chemist or organic chemist look. The molecule must be very tiny. So as simple and can be affordable and can be make tons together. For your information, all this molecule is like our food grain. Tons together, it's going to be made actually. So even this Cipla in our, I think Goa unit, they make even Goa and Mangalore. So all these units, they are going to make a large number of this kind of quantity of molecule. So and supply to other countries. Even if you think about recent hydroxyquinoline, which is anti-malaria, which meant for earlier, but now the people were used for the COVID. So even they succeed. Again, it's person to person and geographical. Everything has to be taken care, whether it's going to be a work or not. So these are the simple molecule, you can check it. So now we have a cocktail of at least 4 or 5 drugs in a one pill is usually administered to control the HIV. Let's look at, so simple way, HIV bed. I think it's okay. What is my time? How long I can take?
10 minutes, sir.
10 minutes? Okay. So all right. So I think if that is the case, this is what the beginning of story. So usually it is started in 1983 immediately, because the people were trying for viral studies, and they developed zidovudine. That is the one of the simple drug actually, but immediately they are taken for HIV, like what we are using now, paracetamol and hydroxyquinoline, similar kind. It is meant for other work, but in that period they come across this kind of problem. So they tested at least within 2 years, they started giving this kind of tablets for antiviral therapy. This is the anatomy. Just you take this anatomy at least good in the next few slide, because I am going to work where my work is standing. So this is the most important. If you look at complete structure of this HIV, you can see it is containing envelope protein GP120, and it is membrane bound. It is GP41, and P17 matrix protein is there, and another most important is P24 capsule protein. The P24 important. In between or inside the P24, you can see this genetic information, that is RNA and reverse transcriptase. This is the pathway it goes, entry process they call. So where my work is stand in the beginning only. This is called a novel generation they called. Still has to be developed, actually more work on this, but preliminary what you guys looked at in the stage 1, stage 2 we are passed actually. Still further they are looking for the company to develop actually. So it does wonderful actually. This is the entry level only we are going to combat this HIV. But that's what, again, what kind all, whether it is going to be vaccine or tablets, one has to be think and do it actually. So this is what we are going to work on, the peptide triazole, where it is going to bind both CD4 and co-receptor 17B binding is going to be stopped. Okay. So I think this is what the structure of GP120. That's what you guys looked at. It is called envelope protein. That is GP120. That is glycoprotein 120. So 120 kilodalton, 120,000 dalton. Okay, that is the mass of this molecule. 1,20,000 mass of this protein, which is called envelope protein. So I think if you look at the list of proteins or peptides or small molecule which are available for this, the one which is there already fusion like that, it's a 36 amino acid T20, N-fluoridine T20. It's a 36 amino acid residue peptide which is available for that is a Roche company is already developed in 2010, I think. I think 2000. So it is developed and it is FDA approved. It is already in the clinical trial. I mean, already in the treatment. So, but the cost is very expensive. 36 amino acid, and usually it is going to be given as a what is called injection mode. Let's look at, there are many issues one has to be encounter the development of this kind of molecule. The most important is drug resistivity. Because if you look at the pathway of this HIV, so usually it undergoing rapid mutation. So rapid mutation, it means that the content of the protein, viral protein, going to be changed each time. It means that so one drug you have taken today, it may not work for tomorrow. So in that condition, so you are in. That's why usually the drug resistivity is the most important problem you guys come across to develop better quality of drug molecule. That's why you can see a 30, 40 kind of drug molecule are developed. And another most important problem is patient compatibility. So I already said that hydroxyquinoline work in India but not in US, something similar kind. Okay, and other is quite common. Let's look at how it is I started work actually. So this is the peptide. Actually it's a toler peptide which is reported by other group. So by phage display method, they called phage display method, they screened and target for HIV and envelope protein, that is GP120, and they found at least okay kind of activity. So micromolar affinity, but it's micromolar and all peptide is very expensive. If you make it such kind, and you're going to a lot of economic or tedious workup. So to make further modification on this, we have done it actually. Further modification on this peptide lead us very good lead molecule, and that lead molecule further we explored another very interesting property of activity. So I think peptide coupling you guys knew. I think if you are MSc student can understand. So the peptide coupling is the most important area actually. So it is peptide bond plays very important role, especially in all the biological system, especially all proteins containing this peptide bond. So you already knew that in the biomachinery and the nature create wonderful protein machinery, and it is very good industry for making protein. You can see it here. That's what I said. If the your virus carries RNA, that has to be go DNA. Then DNA will go to RNA. Then RNA will go to peptides and protein production. This is the standard, so central dogma process, which is already well established biomachinery, which goes in this pathway. That is called translation and transcription. One has to go to produce the required protein. So even RNA is there, that has to convert our DNA. DNA then goes to the RNA, then protein, like this. So this is what happens in the ribosomes or in the real life. So the peptide concept was started with Emil Fischer. So you can see in 1902, Emil Fischer started simple dipeptide, that is by using glycine. And now you can see a lot of problems, just looking structure is easy and what is there and all. But when you go reality, it's going to be more complexity and more difficulty. So let's look at chemical synthesis. We have today solution and solid phase. In the solution phase, you can see so much of protocol where you can see in the early days started problems like this. Just you take two amino acids, one is COH, another is NH. You presume that you are going to get this NH2, CONH, that is peptide bond, and elimination of water. Usually this reaction at room temperature not takes place. It requires high temperature, that to 200 degree. So you might be looked at a biochemist or biological people doesn't like high temperature work, because the molecule go other problem or the safety concern. So it may go for other kind of reaction. So that's why it doesn't like more exhaustive temperature and all. So even if you take another problem we come across, if you are not taken proper protection, so by permutation and combination, if you simple do a dipeptide, if you want to make it, you are going to get two kind of different peptides. Okay, so this is not allowed. You might be looked at. So all proteins and peptides which are available in the nature has to be specific in its activity because of its having specific secondary and tertiary structure. If you change one amino acid residue in that, so you are going to see very exhaustive problem in the life. The simple example is your sickle cell anemia. You might be come across, I think. Sickle cell anemia is a blood related problem, So what will happen in that, because of hereditary or some problem with the manufacturing, so the protein in that, it's going to be just one amino acid change, that's it. Valent to, I think, alanine or something else, isoleucine. So that lead the life-threatening diseases, that is sickle cell anemia, just one amino acid change. That's why what I mean here. So we have to aim for better design of peptide, and you have to get the same peptide, no compromise in that. For that, we have to take some precautionary. So to overcome all the above problems, so this is the standard protocol. Today we have a variety of methods are available to smoothly synthesize the peptide, where it is called N protection. You can see one amino acid alanine is N protected, and another amino acid is C protected. This is the standard protocol. So if you have N and C protected, immediately you can get one type of product. So obviously we have to go for reverse engineering. So where N protection what kind of, and C protection what kind of. And here one has to take more challenging and consideration the racemization. Even 99.9% you must be free from racemization, then only the people will accept for the consideration of your methods or molecule. Otherwise, if it is the racemized, no use, it's just junk. Okay, so for that you can see that. So here the N production you might be looked at, people or MSc maybe there in the syllabus. So very mild carbamates derivative usually come across, that is called BOC, Z and EPMOC. So where EPMOC is a mild condition, you can remove like 20% of piperidine, Z hydrogenolysis, tertiary butoxy, simple acid we are going to use to remove that one. Once you have done your job design, you have to take out the N protection and C protection by simple protecting group they called N protecting and all. All right, so let's look at there are many demerits of solid solution phase. The most important is solubility. When you aim for 5-10 residue in a solution phase, so the method is not going to allow, because solubility issue come into picture. To overcome that one, 1964 or 63, Bruce Merrifield come up with idea. So we can do the synthesis of any required sequence on solid support. That is called Merrifield resin come into picture. For his innovation, he got Nobel Prize in 1984. So for the simple methods, which is solid phase, today if we have money, so you can get instrumentation, that is automatic synthesizer is there. Only you have to feed a lot of chemicals, that's it. Otherwise, you can even sitting at home, you can make plenty of peptides for your interest. So before going to more, solid support is like this, where the organic molecule it's going to bead, that is styrene and divinyl benzene. You are going to get a round of CH2Cl functionalization. That is called the Merrifield resin. So we have other, with this Merrifield resin, today we have 100 varieties of simple resins are available based on what kind of product you want at the end of C terminus or N terminus. One can select such kind of a molecule. Another one is ring command I written here, where NH2 is going to be, means COH is going to be attached here. So I think before much, let's go for my work. So here the thing is KR13 is me actually. What I did, just I already looked at my senior is made 12 mer peptide. So I have taken 16 mer peptide. Just I extend a 4 amino acid residue on C terminus end. These all peptides were made. What I said earlier showed instrumentation, that is solid phase peptide synthesis, and we get 99% purity. All is checked by thoroughly semi-prep column and also analytical HPLC, then followed by mass, NMR, everything was done. So that molecule we have taken and done the simple, I already said that in vitro studies on bioassay. Usually I was in biochemistry and molecular biology lab. So they have extensive established methods in their lab. So what we did, just you take it and make the serial dilution. You can do ELISA, that is 96 well plate, and we have antibodies by primary, secondary, put it and load it and go for colorimetric estimation by simple readout by using visible radiation, visible plates reading. That will give you straight away. So how your molecule like that. That is the basic we does. Then obviously we'll go for SPR and ITC. That is going to be this EC50, effective concentration at 50% inhibition, is a cell biology does. So what it does, they make uninfective, means a single round virus they called, that can be produced in the laboratory by engineering. So what they do, they don't have in that protein that RNA, that is the inner core material, it won't be there even if it is spell out, but still they take extra care, but still even if it is spell also not an issue, because it's a one-time infection, later it won't affect. This is what the people working on this area. So if you look at the KR13 is going to be show very good activity. So because of some added residue, that's we are going to see what is that mean. You can see this is the SPR data. What we'll do by dose response, like 0.98 nanometer to 125 nanometer, we run a sample in direct interact with your target protein, which give the data. If you data refine it and make a process by using that software, you are going to get like this graph, and you have the graph that what is that workout and the software, it is going to give you straight away the dissociation constant. The dissociation constant is directly proportional to the IC50 values of the drug molecule, means whether it is a binding or not. You can see it here. So with this nanomolar 10⁻⁹ molar concentration, you just imagine. So our molecule is going to be show very good pattern of binding, and it is going to be give ultimately these are the second B is in this right hand side. The red and block is due to the ELISA test actually done with our sample. You can see the IC50s are very good actually, 45 and 25 nanomolar concentration IC50 you are going to get. In SPR you are going to see 11.3, means that by this doing bioanalytical technique, so you can see that our molecule is retain the activity, and obviously it is going to be more better than existing in the laboratory. All right, let's look at because our idea is putting that C terminus cysteine is already we had planned, because in the literature we looked at there is a very good chemistry developed gold with sulfur. That is the reason actually, because obviously gold is everyone like it, love it. So that is the gold actually which we are used to gold salt. You already knew about gold, all these properties and all. So not much delay, because the ultimate I want to say here, the bond between sulfur and gold is very strong and well established and can be done. Okay, that is what mean. So we looked at literature and we saw that there is very simple, even we can't go for exhaustive method in the biochemistry lab, just a simple sodium citrate in water method which is developed by friends et al. So we looked at and we adopted the same protocol for making gold nanoparticle by using auric chloride. Okay, chloroauric acid or auric chloride you can say. So what is that? By using simple acid, That is, I think in the previous you looked at my colleague Manjana said that. So nanoparticle preparation by using oxidative and reductive methods, especially he has showed many acids, citric, ascorbic acid, oxalic, and many more. So here sodium citrate, it's worked actually and very fantastic. And you can see by looking at the color within 2 to 3 minutes, you can see that. So you are going to see very beautiful dark red color. So this is the indication actually. Then obviously it is examined through UV simple absorption. Is everything is available actually in the literature. You can check it. So the beauty of selecting this oxidizing, the citric acid is by varying the concentration of citric acid, you can get the different size of the aurum. That is what our idea actually we wanted, because we want to make as smaller as small, because you already knew that that has to penetrate through even in vitro and in vivo studies also. That is what our aim actually means. When you take a virus and if you put it over a nanoparticle, that has to be can you visualize my slide?
Yes, sir.
Okay. All right. This is what in the down the left hand side you can check it. So by varying the citric acid, you can get different size of the nanoparticle. So this is what we checked, the homogeneity of the nanoparticle we prepared is good or not, or is it homogeneity? Because that is utmost. I think the material people will talk about homogeneity is more important, even if you take it semiconductor and all. Similar way, we want to very unique or homogeneous nanoparticle must be there for our purpose. With taking all this consideration, we done it. So you already knew that the aurum nanoparticle conjugation can be go for covalent and adsorption. Even we tested both actually. So, but the adsorption technique is not at all good because it's not reproducible. When you sent the paper to the referee, then they said that how come all this thing and all means. If someone does the second time, it won't be does same. Even we ourselves, if we does second time, the adsorption property not same as the previous batch. So that's why adsorption property, especially for this area, is not considered. Then we went for covalent. So already we know this sulfur and gold, this one. Bonding is going to be very effective by using BSPP as a stabilizer actually, because you already knew that the nanoparticle, if you keep it, so it can't be stable to make the little more stable because of electronic nature and all. So and highly reactive. So we are going to mask that one or make avoiding or called stabilizer we are going to use. And with the stabilizer, we are going to make this sulfur linkage. We have this method actually very simple. Is not even all in done in simple F and up. That's it. Not in RB or beaker and all. This is the stabilizer. What it does, stabilizer, you can check it. It is going to be pull out. So obviously, aurum is going to be more electron positive nature. Then obviously the sulfur linkage goes. So okay. So this is what the ultimate data we got it actually, and by using TEM you can check it. So very beautiful structure of aurum nanoparticle, you can see it, and the size is almost same, no difference. And also we have taken the aurum nanoparticle KR3, means the peptide conjugated on the aurum nanoparticle. So the size is going to be 22 nanometer also. Okay. So that is what about synthesis. And obviously, after making this solution, conjugation, our most goal is to take this molecule, how it is active in our system. You can check it very beautifully. Even native KR13 means the peptide alone, you can see there is almost 50 times more effective compared to even 1,000 times. You can see other thing, 1,000 times more better compared to the native peptide. When you see conjugated is more effective actually compared to native. Why it is so? Because you already knew this, the growth, the one nanoparticle, it is going to have a multi-conjugation. On one surface of the gold, you are going to say many conjugated peptide is going to attach on that. So that lead, so more conjugated and more effective. So obviously it act as a better lead molecule. So almost we looked at very good impressive data. This is directly for live virus, not live. That is what engineered virus, which are available in the laboratory of cell molecular biology. So they made it this one. I'm not done this work actually. This part, the rest bioanalytical and the rest stuff you done it. And other right hand side you can check it. This is the one where toxicity is the lead like that. So you can see both the peptides and the standard is behave similar. It means that it is not harmful to our body. So we have done another most important, which is not established by anyone. So that is called P24 release. If you look at the anatomy of this HIV, so the P24 is a core inside the core protein, which is again inside. You are going to see genetic information. That P24 we are going to be able to extract. Means we are going to identify by putting just this gold nanoparticle, or even K13 itself also exhibit the property. So both the molecule, both the Kr13 peptide itself or conjugated to Kr13, both is going to be work as a P24 release. Means that inner core P24 protein is going to be released. How it is? Just take your balloon and put it in, punch it or pin it. So you'll see all the air inside it's come out. Similar fashion. So what it does, this peptide, when it is bound onto the surface of the virus, it is going to interact with the, because of free sulfur, it's going to usually go for disulfide bridges or some kind of mechanical stressing takes place on the surface of the protein, virus. It lead the inside the material can pop up easily. That is what we looked at. But when you check it, previous any reported molecule which is available in the literature, it doesn't show such kind of property. This is the one unique property we looked at, means it is called lysis, or you guys looked at in the simple chemistry, hydrolysis and all, here virolysis. The virus is going to be chopped like anything, and inside the core material come out, and that can be determined. Simple methods are available. That is, by using primary and secondary antibodies of P24, one can estimate how much it is there. This is what mean. You can see it. Our molecule is going to disturb somehow. We are not much sure, but we presume that this is what happening, because the GP120 our molecule is binding. So that is already we know a very good strong word on that. So then it is going to do something, mechanical stress or some disruption to the envelope protein. Then obviously the membrane will be take out and pop up, something like your balloon. Okay. So that P24 is going to be released out. So this is what we give a mechanistic way, why it is and all. So obviously from this we are able to publish many number of papers, which is all related to biochemical, and patent also it is under. Just not much time. So this is what you guys looked at, the SARS-CoV. This is the pandemic today we are facing. Because of that, today I am not face to face you. So that's all virtual. Maybe that made it anyone can connect through virtual only around the globe. And it's very pathetic actually. You are seeing so much a problem with this. You can see this is what spike glycoprotein. Again, they say already a lot of studies was done. Still more required to understand the complete biochemistry and molecular biology of this protein must be there. The prevention right now is more important. You guys, I think, listen in the radio also, SMS. So sanitize, mask, and social distance is the most better curing technique. That is the most important. So I'm not going much detail because I was reading actually. So this is the envelope protein they found actually. It is going to bind on very strongly. Might be you looked at 2000, I think 2 or 12. It's another pandemic has come, SARS, and later you guys come across another more. But this SARS-CoV-2, the earlier one is SARS-CoV-1 is lighter binding actually, but this one SARS-CoV-2, they found that it's going to bind very tightly to the this protein which is present in our body, that is angiotensin converting enzyme, which is present in our lungs. Okay, so where in our system we have this ACE2, it's going to bond very tightly. That is the one of the biggest problem we have due to this SARS-CoV-2 compared to SARS-CoV-1. Because SARS-CoV-1, if you take a precautionary and other thing, it can be done. But this one is going to be more pathetic. So CoV-2, that is the one of the thing. And another more important, you guys knew that if someone is infected, even his saliva or this whatever is touched, all these places, it is sustaining, and obviously when you breathe in, so immediately get inside and it will start to immediate action and get worsen, and it is going to give you more respiratory, so and more worsen to elder because their resistivity and strength is going also countable, but less vulnerable to the adult, but still one has to take care of both of this. I think why I took this one because it's almost related to that one I found actually. So maybe we need, and obviously, so to tell now the laboratory can ask me, sir, this is all this thing. Okay, but now I started here also work. So as I said, as an organic chemist, we are working on more on method development for making bioactive molecules by using simple methodologies like green chemistry and very mild environmentally friendly protocols are developed. Okay, still more has to be developed. Right now in my group, 6 members are working. So two are submitted actually PhD. It's okay. I mean, our work is going on. So not much this kind of translational. Maybe in the future days I can see a little more on this area. I thank you very much all the organizer for this opportunity. Hopefully I can take any questions if you are drop in chat box or any. Okay. Thank you so much.
Thank you, sir, for such an interesting and informative presentation. We thank you wholeheartedly. Now, like feedback link will be soon shared in the chat box and also in the Telegram link. So please kindly fill the feedback form, and also in case of any discrepancy regarding e-certificates, kindly mail us to jtcchem23@gmail.com. jtcchem23@gmail.com. Now, I request Professor K.S. Redder ma'am to propose vote of thanks.
Good afternoon, everyone. Today, we all have entered into a new world of chemistry to conduct one-day national level webinar on frontiers in chemistry. Now it's time to express vote of thanks. On behalf of KLE Society, on behalf of JT College, Principal and Department of Chemistry, and on my own behalf, I express my sincere gratitude to resource person, Dr. Jayappa Manjanna, Professor, Department of Chemistry, Rani Chennamma University, Belgavi, for giving a talk on resources, recycling, and waste management. I also express my gratitude to another resource person, Dr. Kantaraju, Professor, Department of Chemistry, Rani Chennamma University, Belgavi, for giving a talk on multivalent gold nanoparticle peptide triazole conjugate in inactivation and viruses of HIV-1. I would like to give hearty thanks to C. Lingardi sir, Principal, JT College, for giving plenary speech and for his kind support and guidance to organize today's webinar. I thank convener of today's webinar, Dr. M.B. Patigar, HOD of Chemistry, for organizing the webinar and introducing the guest. I thank organizing secretary, Dr. Kumar H.K., for his organizing the webinar and introducing the guest. I also thank all the participants from different parts of the country for your kind attention. Lastly, I thank all the teaching and non-teaching staff of JT Parivar for their support. Once again, thank you one and all.
Thank you.